Welcome back to Do No Harm, where we fight for patients and against identity politics in healthcare. Podcast hosts Benita Cotton-Orr and Dr. Stanley Goldfarb will highlight the medical industry's most pressing issues and dangerous trends, and discuss how we can achieve a better healthcare system for all.
Stan, let's talk a little now about how we stand up for what we believe in combating this woke ideology that is denigrating and diffusing the effects of the kind of healthcare that you have been trained and believe in to provide.
Yes, well, it's a very tough battle because there's no question that once some of these cultural issues become embedded in an institution, it's very hard to give voice to individuals who don't feel that way. And so I think we're going to try very hard to provide information. Information is always critical to show people that some of the research that's been used to justify some of these woke initiatives is flawed when it is flawed, and it's usually flawed. That's the commonest experience that I've had in reviewing it. We're going to provide a voice for those physicians, medical students, other healthcare workers that have identified situations that made them very uncomfortable, and we've been able to help them push back. For example, when it's been required that professors in medical school have DEI statements, in other words, statements that show how they've supported diversity, equity, and inclusion initiatives in their careers, that's a requirement for their promotion. We've pushed back against this. We've helped professors at institutions like Indiana University School of Medicine push back against these kinds of requirements, and we're going to push hard to make these requirements illegal because they represent an abridgment on the freedom of speech of these individuals. So if they don't believe that those kinds of efforts are the best way to achieve the best health care for their communities that they live in. We're going to provide a voice for medical students that have been concerned about some of the courses that they've been asked to take. We're going to give voice to physicians who have rejected the idea that they need to take implicit bias training in order to get their licenses renewed. This has occurred in 2 states now, in Michigan and in Massachusetts, and we're going to help physicians push back against that because these are requirements that are governed by state legislatures, and we can have a legislative agenda as well that helps push back against this. And finally, we can look to the kinds of requirements that are being put forth for in medical education, the kind of requirements that are being made in, as I said, in continuing medical education, the kinds of requirements that are being asked of medical students in their applications to medical school. We can identify this for the public. That means for the representatives of the public in various state and federal legislative offices, and to try to push back to show that when these kinds of activities violate freedom of thought, freedom of speech, that they represent activities that we need to eliminate, we need to oppose, and we need to allow that the scientific ethic to flourish in medical schools and in medical education, and we need to have equality in healthcare where all patients benefit from improvements and not just try to target groups of individuals because of their ancestry, because of their heritage.
So you and I have collaborated in the past on some op-eds that we've had published out there. And Do No Harm has really established its credentials, I think, as an outspoken opponent of this woke ideology in medical institutions, in student selection, in the colleges. And every time you turn a page now, you see more and more accepting articles about how this is infiltrating institutions, hospitals, colleges. I know that not everybody can afford to be as outspoken as Do No Harm. And I know you've heard some stories that are frightening and unnerving from physicians and from students. Would you care to talk a little about what they're telling you and what when they reach out to Do No Harm?
One thing we've heard from physicians, particularly about the implicit bias training, which they've been forced to take, is that it undermines their whole sense of what their careers have been like, particularly if they've been physicians for some period of time. They're being told that they were biased, and they feel like, no, I'm not biased. And they're being told that, well, you have unconscious bias. You don't even know when you're being biased. And that may very well be true, but they've said, look, I don't know what unconscious thoughts I have because they're unconscious by definition. I do know how I act. I know how I treat people. I know how I attempt to treat my patients. And I know the way I feel about my patients. And that's what I do know. And this training is telling me that those feelings, those thoughts, those actions have not occurred when in fact they have occurred. And they're very distressed about this because it undermines their sense of what it's like to be a physician. We have one physician whose work has been censored by the American College of Surgeons, who have prevented him from speaking out on their website. He's a fellow of the American College of Surgeons, and he's been told that his ideas are not acceptable. And his ideas were simply those of saying, look, I've always treated my patients the same. Telling me that I've treated my patients in a racist fashion is absolutely unacceptable and not true. And telling me that we're going to act in a way that favors diversity as opposed to meritocracy in the American College of Surgeries is something that I can't support, because I think that it's important that your surgeon be the most qualified, competent individual that it's possible, because your life is in their hands. And that and by rejecting these ideas, he's been sanctioned by his organization. And we're giving him voice to speak out and to allow these ideas to be available to the public.
Now, Do No Harm is taking it further. It's not just giving these individuals a voice. We are actually taking action. Talk a little about that.
Yes, well, it's sort of interesting that Heather McDonald was on the Tucker Carlson show recently, and she's written about these same issues, and she's a very well-known author. She was asked by Tucker Carlson, why isn't anybody else speaking up about this? And her answer was, well, they're all afraid. Well, we're not afraid. And we have been speaking up about this. And for example, we have sued the federal government now because they recently passed a rule within the Medicare system that physicians who establish anti-racist protocols in their practice would get incremental payments for seeing Medicare patients from the federal government, from the Medicare system. And we feel that this is something that really is a terrible initiative because, again, anti-racism, according to Ibram Kendi, who's one of the fathers of this field, is that past discrimination justifies present discrimination, and present discrimination justifies future discrimination, which means that the only way to make up for what happened in the past is to have discriminatory practices be present in medical care now and in the future. And anti-racism protocols in individuals' practices means that they're going to treat patients differently based on their skin color, which we feel is un-American, we feel is wrong. If they're going to have quality improvement programs, all patients should benefit from them. If the quality will improve for Black patients, it should improve for white patients as well. It should improve for all patients. And this lawsuit has gone forward. It's been taken up by a physician, Dr. Alvarado from Kentucky, who's a legislator as well as a physician, practicing physician, and a physician in Mississippi is also a plaintiff in this. And they feel like they've been asked to do things that they don't want to do. And the only way that you can get this extra payment from the government is to act in ways that they felt was against their conscience and against the ideas that they believe in, the way medical care should be practiced. So this lawsuit is underway, and we've supported that very actively. Other things that we've done is we've identified the fact that there are a number of scholarships that have been placed by various hospital systems as well as medical schools to try to attract minority students to come to their institution to train further in medicine. So medical students who are interested in pursuing residencies are being attracted or attempted to be attracted to institutions by providing these scholarships to come and visit their institution and learn about their institution and spend time as a visiting student at that institution. Well, these scholarships specifically deny the opportunity for white students. Only minority students are allowed to apply. Well, this violates the Civil Rights Act, and we've called out many of these institutions, and we've written letters to the Office of Civil Rights, and we've had feedback from some of these institutions even acknowledging that these are illegal, these scholarships, and they were done without the advice of their counsel of the institution because, again, these are people who think they're doing good, but in fact what they're doing is perpetuating discriminatory practices that were eliminated 50 and 60 years ago in the United States because they were felt to be discriminatory. Now they're discriminatory against white people. Then they were discriminatory against black people. Discrimination is bad, no matter who it's practiced against. And just think the resentment that this sort of activity could produce. A white student who's poor, comes from a family that he's the first or she's the first to go to college, to go to medical school, wants to visit an institution, doesn't have the resources to do that, but their neighbor, a black student who may be quite wealthy, may come from very accomplished parents, gets the opportunity because they simply because of their skin color. This is unfair. This is not American, and this is something that needs to be rejected.
Well, thank you, and I just am so impressed with the work that Do No Harm is doing, and let's just make sure that we keep doing no harm.
Yes.